Hey guys, welcome back. This is part 2 on a discussion of the profession of pharmacy. I got cut off accidentally. Sorry, I didn't turn my phone ringer off. But anyway, this is part 2, and I left off talking about how as a pharmacist we don't prescribe, and that's more to do with the politics. So even though we need to know how to diagnose, just about legally we are not diagnosing. Okay, so I hope this clears up any of those myths or those misconceptions that we're pill pushers, because we are not. Okay, we do not even prescribe. The only thing that we are doing is filling the prescriptions as they're written, but we're also the gatekeepers. Because of the responsibility that is on our shoulders as a practitioner, as a pharmacist, and taking that oath and making sure that what you dispense or what you let slip through your fingers is safe above all and appropriate for the patient. If something's wrong, it's your butt too. It's not just the person who wrote it, and probably more so yours, because you're the gatekeeper as a pharmacist. You're the last person that prescription bag touched before it was sold to the patient. Okay? And we have to be careful, we have to be sure. So when you're in that outpatient setting, the retail setting, and you're dealing with some of these people out here that are just acting as plumb fools out here, because, we get it. You've been in the emergency room for 20 hours and you're ready to go home. You just want your medication and then you want to go home. But please understand that the pharmacy is the extension of the emergency room. It's not a fast food joint. So although you have these chains in retail pharmacies that are all about numbers and pushing numbers and as many prescriptions as they can fill, there's a level of customer service and prep that is being lost upon too, with that level of activity and disregard for what the practice of pharmacy is. So, pharmacists, for many years, I don't know how far up on the trusted list of healthcare providers, but, for the longest, the most trusted and the most connected, because we connect to pretty much every type of doctor there is. We have to have a conversation with them. Because yes, okay, good for them, lucky for them. The cardiologists, they're only focused on cardiovascular disease and the drugs associated with that. Optometrists are only concerned with the eye and anything disorders and ailments that are concerning the eye. The urologists, they're just thinking about the genital, the urinary tract. That's it. There are no cardiologists, pharmacists, there are kidney pharmacists, eye pharmacists, dental pharmacists. There's no such thing. There's just pharmacists, which means we need to be up on all of it. And there's laws that are involved as well with dispensing of medications. So we have to make sure that the person who is writing it has the authority to do so, and that they're not writing something out that's outside of their scope of practice as well. It has to be appropriate. So there's so many moving parts, so many things from when you hand over your slip of paper to a pharmacy counter to when you get that bag. And a lot of times people, they just don't understand, because they just don't know what we have to do and what we have to go through. We have to pretty much scan your entire medication profile and check for everything in the split seconds, minutes that they give you, from typing it to printing it to counting it out to putting it in the bottle, making sure what's in the bottle is on the label, etc., right? So those are the things that we have to do in practice, and there's a lot of pressure and burden. If we mess up, man, we got to stand before the National Board of Pharmacy, the Department of Professional Regulation, and they will discipline us in our license and our ability to basically eat or take care of our kids, because a patient, we let someone bully us into getting it out instead of standing our ground. I'm not saying that this has ever happened to me, because I've always stood my ground. I probably got in trouble the most with my previous employer, because I did not allow patients, doctors, or corporate entities, you know, supervisors and whatnot, intimidate me or bully me when it came to prescriptions and patient care. If it's not right, I'm not dispensing it. Sorry. And I reserve the right to do that, and the law protects me to be able to do that as the pharmacist. If it's not right, it's not right. And I'm not putting my license or someone's life on the line because somebody else feels that they, oh, just fill it, it's fine. No, it doesn't work that way. You take an oath to protect the public. That's what we're supposed to do. So I hope, if anything, you know, that there's a little sympathy given to the neighborhood pharmacists, and that you guys take it easy on your neighborhood pharmacists. They're really only there to help, and we're not pill pushers. Pharmacy is not pharmaceutical, okay? And we do reserve the right to refuse a prescription if it's not safe or if it's harmful to that patient. So again, I'll put the information in the description box for the people who are looking to pursue it as a career path. I did it in the last video. I'll do it again here as well. And for those of you who are interested as patients of mine, I don't dispense medication as a pharmacist. I'm more consulting, and I have the competence and the knowledge base to assist you in your medication therapy management when you come to see me for whatever other reason that you will, okay? I welcome all questions and comments and other concerns, and I'll see you guys in the next video. Bye.